Hello friend, today we are going to discuss pharmaceuticals topic. As per as our chemistry paper is considered, pharmaceutical topic is very important because it is related to the drugs or medicine. We know that human desire for long and healthy living has kept him searching remedies for the suffering. The foundation of modern medicine was laid by the Greek physician Hippocrates before 460. He, he for the first time introduced the concept of disease and pathological, which having cure and nature, process and try to organize it. Therefore, this is very important topics. In this topic, we are going to study classification of drugs on the basis of functional drugs as well as chemotherapeutic agent. Thereafter, we are looking the qualities of ideal drugs, and finally, we are going to discuss the synthesis and uses of some selected drug. What is drug? Definition. It is the chemical substance or a natural product used to prevent, treat, cure or diagnose the various kind of diseases or pathological conditions of the recipient. It's called as drug. Drug is a French word meaning it's dragu meaning dry herbs. Drug, when administered into the body, it helps to restore normalcy. It is said to have curative or therapeutic action. So this is very important part of drugs. When we take that drug in very small quantity, then it is act as a drug. But if it's taken in excess quantity, it will not be useful. It may have some bad effect or side effect. So drugs are classified on the basis of functional drug as well as chemotherapeutic action. So what kind of action that drug have, on the basis of that things drugs are classified as follows. Classification of drug on the basis of chemotherapeutic agent. First of all, what do you mean by chemotherapeutic agent? They are the drug used in the treatment of infectious diseases. The pathogens are disease causing parasite, microorganism, for example, virus, bacteria, fungi, mold, protozoa, etc. The chemicals used to block the multiplication of pathogens, which is called as static drug, or kill the pathogen, called as cidal drug, are called as chemotherapeutic agent. This shows selective toxicity to the pathogen and innocuous to the host based on the disease cured or the nature of pathogen acted over. These agents are subclassified into the following drugs. First is called as antiviral drugs. For example, antibiotics and animatodine is the example of this one. Another type is antineoplastic drug. They are the drugs used for the treatment of cancer. For example, melphalan is the example of this antineoplastic drug. Next one is antiseptic and disinfectant drugs. Antiseptic agents applied directly to the skin, wound, etc. are known as antiseptic agent. The disinfectants are bactericidal, which are applied to non-living surface. They are rapidly produces irreversible lethal effect. For example, phenol, pioform, Dettol, etc. Then chloramine T, boric acid, potassium permanganate are used for the flooring, cleaning of flooring, dressing, then mouth washing, gargles, etc. Next one is antifungal drugs. For example, neostalin is the antifungal drug. Next type is anti-malarial drugs. There are different type of protozoa and they caused various kind of malaria, just like Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. And it is very important anti-malaria drugs, just like chloroquine or pharmaquine. Next example, next type of drug is called as antibactericidals and anti-leprosy drugs. So these are again very important. For example, protonsil is the antibacterial drugs. Sometimes sulfur drug is also being applied for that one. Then anthelmintics drugs, it is again very different. It is very important drug. They are the therapeutic agent used to kill or remove helminths or parasite worm in the infected host. For example, those helminths which kill the worms are called as vermicidal, while those which help to expelling them are called as vermifungus. So again, next type is called as antiamoebic agent. The chemotherapeutic agent used to cure amoebic infection is called as antiamoebic agent. So drug classified on the basis of functional drug. What do you mean by functional drug? These are the drugs modulate, stimulate or depress various physiological functions like blood circulation, blood filtration, respiration, growth, etc. So therefore they are used to overcome the symptom of discomfort due to the change in physiological activities. Further, depending on the function affected, they are divided into the subgroup according to the following types. First one is CNS drug, which is called as central nervous system drug. The communication system of the body consists of the central nervous system, brain and spinal cord, and peripheral nervous system, nerves and ganglia. Under the pathological condition, a number of chemotherapeutic agents are used to reduce the pain and suffering. First, depending on the effect produced or the system affected, they are classified into following. CNS stimulant, for example, they activate the central nervous system, so they are used to cure psychotic state, for example caffeine or theobromine. Another one is tranquilizer. Tranquilizers, they are decrease the psychomotor activity without causing sedation, hence they are called as tranquilizer. For example, chloropromazine or promazine are the example. Next one is hypnotics. They are the CNS depressant which produces sleep. The patient cannot be easily awakened until the effect of the hypnotics wear out. For example, luminal or Veronal are the example of this drug. Then sedatives, they are the CNS depression that reduces restlessness and emotional tension without producing sleep. For example, luminal. Then anticonvulsant drugs, they are also CNS depressant used to prevent epileptic seizuring, selectively affect CNS without causing the excessive dorsiness. For example, Noctal is the example of this. Then anesthetic is again important to drug to produce partial or local loss of consciousness. Example of analgesic drugs are diethyl ether, chloroform are general anesthetic, while novocaine is the local anesthetic. Next one is analgesics. They are used to selectively depress the CNS and relieve pain without impairing the consciousness. They act by raising the threshold of the pain perception. For example, aspirin, paracetamol, codeine, morphine, etc. Next one is antipyretic. These are the drugs which reduce or lower down the body temperature in condition of fever but do not decrease the normal below normal body temperature. Many antipyretics have been used as analgesic, and for example paracetamol, antipyrine and phenacetin etc. are the example of antipyretic. Then antihistamine, they are the drugs used to reduce or prevent several pharmacological effect of histamine. Histamine is a natural metabolite form in the body. At higher concentration in body, it produces wide-ranging psychological disturbances like oedema, gastric and duodenal ulcer, respiratory congestion, lacrimal and nasal secretion, etc. So these conditions can be relieved by using antihistamine agent, for example, Benadryl, then ranitidine, chlorpheniramine, etc. Then anti-diabetic drugs, they are the drugs used to control the pathological condition called as diabetics. Diabetics, sweet urine is generally known as simply as a diabetics. It is most common metabolic disorder during which formation of glucose exceed in the utilization. So there is an increased concentration of glucose in blood. It is called as hyperglycemia, leading to its secretion in the urine called as glycosuria. So normally whenever blood glucose concentration of the body increases above normal value 4 mm, the beta cell of pancreas are signaled. They are synthesized and release the protein hormones called as insulin. It promotes glucose utilization in many ways and soon lower the glucose concentration. And whenever relative or absolute lack of insulin occur in the body due to the different reason, diabetics is observed. Two major class of diabetics are there, that is called as juvenile onset. It develop early in the life, quickly become severe and require insulin treatment, and adult onset developed slowly, milder and often goes to the unnotified. Anti-inflammatory drugs. Inflammation is a local response to injury involving small blood vessels. The circulating within a vessels and nearby the connective tissue. The drugs used to manage inflammation are called as anti-inflammatory drug. They modified the inflammatory response to disease, but these drugs are not themselves curative and do not remove the underlying cause of diseases. An ideal anti-inflammatory drug should affect only affected area or uncontrolled inflammation, but must not interfere with the normal inflammatory response, which is a part of the body defense mechanism. Next one is cardiac drugs. They are the drugs. They represent a group of drugs which have the direct action on the heart or other part of the vascular system. So they are modified the total output of heart or disturbance of blood to certain part of the circulatory system. They are sub divided into the following groups: cardiotonic drugs. They are the drugs used for the treatment of congestive heart failure and certain cardiac arrhythmic conditions. Antihypertensive agent or drugs, these are the drugs which can be used for the reduce the blood pressure of patient. Normal human being having the blood pressure range 120/80. Then next drug is called as anti-hypercholesteremic drugs. They are the drugs which can be used to reduce blood cholesterol level in the body. Then sclerosing agent, these are the drugs used for the obliteration of dilated veins. And next one is antiarrhythmic agent or drug. They are the drugs used to modify cardiac rate and rhythm. And finally, vasodilator. They are the group of the drugs or medicine that act primarily on the vascular system. They dilated the coronary vessel, so used for the treatment of coronary artery disease and especially in angina pectoris. They include the ester of nitrous and nitric acid and certain alkaloids. Hello students, the next part of the topic is qualities of ideal drugs, or give the different types of qualities of ideal drugs, or what are the properties of ideal drugs. This kind of question will be asked. So why we have to study the ideal qualities of drug? Because a systematic substances or natural product which are used to prevent or treatment or cure or diagnosis or analysis the disease or pathological condition of the recipient or patient is called as drug. This drug is a French word which is called as drague. It means that dry herb. A drug, when it is given or administered into the body, it helps to restore the normalcy. So it is said to have curative or therapeutic action. Now, an ideal drug is having or expected to have the following properties. Just like number one, it should be very safe and should be efficient and cost effective. It means that it should not have any kind of side effect. It is antibacterial, antimicrobial action should be selective and effective. Next one is it should be bactericidal and bacteriostatic. It should not induce resistance. It should be safe for the recipient even if consumed for longer period and higher dose. It should not be retained in the body for longer period than the required. It should not be stable enough to allow attainment of optimum concentration of body. Next one, its action should be localized at the site where it is required to. Synthesis and uses of some selected drugs. In that we are going to discuss the different kind of drugs used for the curing the different kind of diseases. First drug is ethambutol. It is an antitubercular drugs or medicine which is synthesized from the nitropropane. In presence of alkali, nitropropane is treated with the formaldehyde. The product 2-nitrobutanol form and is reduced with Fe oblique H2SO4. This is followed by the treatment with copper hydroxide, calcium hydroxide to give 2-aminobutanols. So likewise, when there is a formation of 2-aminobutanols, this 2-aminobutanols, 2 molecule of 2-aminobutanols, when it is treated with 1,2-dichloroethane, it produces ethambutol. So ethambutol is very useful drugs in the treatment of pulmonary tuberculosis, especially it is used for the TB. Always used in the form of its dihydrochloride salt. Generally, it is taken orally along with other antituberculous drugs. Synthesis of isoniazid drug. It is very important drugs. It is an antibacterial drug which is both bacteriostatic and bactericidal action. It is known by other name like isoniazid or ramiform or isoniazotic acid hydride. It is used to fight tuberculosis. It means that TB. It is synthesized from 4-ethyl pyridine. On the oxidation, 4-methyl pyridine forms isonicotic acid. This is followed by the esterification and treatment with hydrazine to give isoniazid. So p-methyl pyridine, when it undergoes oxidation, it gives isonicotinic acid. This isonicotinic acid undergoes esterification in presence of CTH5OH oblique HCl. It gives ester. Then this ester, when it is treated with hydrazine, it gives isoniazid, which is called as the final product of drug. It is isoniazid. Now if you look at the uses of this isoniazid, it is antitubercular drug. It means that it is acting on TB. It is rapidly absorbed from the gastrointestinal tract, so they can be given orally or in the mouth. It should be always include in curing more dangerous form of tuberculosis. Very severe tuberculosis can be cured by using this kind of drug. Resistance to isoniazid develop quickly, hence it is administered along with the p-amino salicylic acid, which delay the unwanted effect. So it means that in form of a combination of drug it is given to the patient so that it gives more action towards the TB. Next drug is benzocaine. It is also called as ethyl 4-amino benzoate. It is the ethyl ester of p-amino benzoic acid shortly called as PABA, PABA, produced by the Fischer esterification. PABA mixed with the excess of absolute alcohol and is replexed in presence of sulfuric acid for over 1 hour. Sodium bicarbonate is added to neutralize the excess acid. The benzocaine crystals are filtered under vacuum, washed it with cold water and then allowed to dry it. So this is the reaction that we have shown over here for the synthesis of benzocaine. And industrially it is very important. Ethyl para nitrobenzoate is reduced to amine in the presence of reducing agent, iron and water and little acid. The starting chemicals PABA needed is readily obtained by the producing p-nitrobenzoic acid under this. So uses of this one, it is useful. Benzocaine is used to treat a variety of pain related conditions. It is a local anesthesia of oral and pharyngeal mucous membrane, sore throat, cold sores, canker sores, toothache, sore gum, etc. Octic pain, surgical and procedural local anesthesia. Next drug is phenobarbital. It is a CNS drug and it is prepared by condensing ethyl cyanide and diethyl carbonate. The product first is formed and it is hydrolyzed and ethylated to give diethyl phenyl malonate. The product is second. When this product second is treatment with sodium and ethyl bromide with urea, it form phenobarbital. So this is the three-step synthesis of phenobarbital. It is useful for the following diseases. It is a potent hypnotics. It is onset of action is slow over 1 hour, but duration of its action is long, 10 to 16 hours. It is also more effective in the control of epileptic seizuring. So it is used in the treatment of general convalescence in children because convalescent action of barbiturate is a part of their hypnotic action. Next drug is chloramphenicol. It is the first of the widely used broad spectrum antibiotics. Means it is useful for the many kind of microorganism to kill it. It is its trade name is chloromycetin and ampicol. It is more effective against the serious infection of both gram positive and gram negative bacteria. There are two kind of bacteria. One is gram positive and gram negative. And if you look at the synthesis of this one, you will find that it is synthesized from p-nitroacetophenone. When this p-nitroacetophenone is treated with Br2 in presence of bromination, it means that bromination we will get the derivatives of p-nitroacetophenone called as bromoderivatives. When this bromoderivatives is treated with the reagent and in presence of HCl and ETOH, it produces p-nitroacetophenone amine, and when this is treated with acetic anhydride, that is called as acetylation, it gives the next product, and this is when treated with HCHO means formaldehyde in presence of Na2CO3 aqueous, it gives the first product. This first product, when it is treated with the reagent, it undergoes MPV reduction and it gives product second, it having the D and L mixture, and this D and L mixture when it is treated with HCl, that is called as acid hydrolysis, it gives third compound, and this is again D and L mixture and when this D and L mixture is together, it both are not useful.
Cough
One is useful,
and
another
urinary
is,
tract infection, but it is
not
only
useful.
recommended
And when it is,
recommended
treated
when
or resolved in
safer
presence of
antibiotics
CHCl2,
cannot be used,
it
and it is
produces
always taken
minus
under the
COCH3, and finally it gives
doctors.
D
Otherwise,
into
it
bracket
may have
minus
some bad impact.
chloramphenicol. This chloramphenicol is very important and useful for the following treatment. It is useful for the treatment of the number of meningitis, plague, cholera, and typhoid, uh, paratyphoid fevers, dysentery, diarrhea, pneumonia, whooping. Next drug is called as paludrin. It is also called as proganil. It is one of the popularly used as anti-malarial drugs for treatment of malaria. It is synthesized from the following way. For the synthesis, we have to use parachloroaniline. When it is parachloroaniline is treated with NaNO2HCl, it gives diazotides and it forms first compound. This first compound is condenses with cyanoguanidine and it gives compound 3 by the condensation of this one. Then next step is third step is treated with in presence of this one, and fourth compound, and in presence of CuSO4 it gives paludrin. And if you look at the uses of paludrin, it is very useful and it is best available anti-malarial drug. It is less toxic than quinine and paraquine or pamaquine. These are the again available anti-malaria drugs, but as per as other anti-malaria drugs are considered, this paludrin is more effective and less toxic as per as our body or patient body. Next part of the topic is drug action of sulfa drug. Now the sulfa drug is very important drug or medicine which are used for the treatment of various kind of diseases. Now why it come and exist? Look at this. The folic acid is the is a growth factor needed for the growth and multiplication of bacterial cells in the human body. In normal course, bacteria synthesize folic acid from para-amino benzoic acid PABA. This aggravate the infection. So to control the infection, we need to block the formation of folic acid. This is arrest the growth and multiplication of bacterial cells. Sulfamide is called as structural analog. Remember this structural analog of para amino benzoic acid PABA, as there is a very close structural resemblance. Both having, if you look at the structure of PABA and sulfanylyl amide, both having the similar structure. The close structure similarity it confused to the bacterial enzyme that normally act as a PABA. So in presence of sulfamide, competition is set between PABA and sulfamide to bind with the enzyme. If the sulfamide SD bind to the enzyme, a non-productive complex is formed and enzyme gets stuck. This prevents the production of folic acid. Therefore, by halting the bacterial growth, thus sulfamide act as a competitive inhibitors for the enzyme and block its productive enzyme activity. Look at the reaction of this one. Enzyme, when it is treated with PABA, it gives enzyme E is there. E-PABA complex is formed, and this E-PABA complex further goes to form enzyme plus folic acid. Here helps bacterial growth. This is the normal reaction happen in the body. But when instead of taking the PABA, if that patient is given SD, means that sulfur drug, this enzyme plus sulfur drug, it gives ESD, which is called as non-productive complexes. These non-productive complexes which kills the bacteria or stop the bacterial growth and block the higher concentration of sulfanylamide need to use to produce totally chances of PABA binding with the enzyme. When orally taken, the sulfur drugs are changed to sulfamylide in the body and presents itself as a pseudo substrate to this enzyme. So therefore, this mode of enzyme inhibition is called as competitive inhibition, means it stop the growth. This idea of confusing the enzyme, it paid rich divided by having a millions of lives and revolutionized medical practice. Acknowledgement. I am very much thankful to the Department of Chemistry of Devadi College, Devadi, for providing DST FIST computer lab for preparation of this presentation. I am very much thankful to the Phadke Publication Kolhapur for getting me the book of Organic Chemistry Semester 6. I used this book for the preparation of this presentation. I am also thankful to the principal Dr. B.T. Jadhav, who inspired me for preparation of this online lecture for the benefit of the students. Also, this is prepared during the lockdown period when India get having some problem of coronavirus, and we use this time for preparation of this online notes for the benefit of the TUIBSC students. And I hope this is the work we have done from the homes, and we got the opportunity, but it is not good opportunity, it is bad opportunity to stay at home, but we are safe. You also take care of yourself.